welcome everyone. I'm so glad you're coming to this webinar today to join me in chatting about some really important things related to autism and wellness and mental health. I'm Sheena Lee. I am a psychiatric physician assistant with MedPsych Associates in New Jersey. And I'll give you a little bit more background once we start the slideshow on what we do, why we're here, and what we love to help with. So I'm going to go ahead and share my screen and we'll get started with the presentation. Okay, so today our presentation is called Empowering Autistic Wellness and Autism and Behavioral Health Support. And just a little bit about us before we get started. MedPsych Associates in New Jersey, we offer a wide range of behavioral health services, and we have special expertise in working with children and adolescents, but we do see adults also. Some services that we provide a full range of psychiatric care, psychotherapy, neuropsychological testing, and diagnostic testing, especially for autism and ADHD. And we are located in Ramsey, Old Tappan, and Montclair. That's where we have physical offices, but we do offer virtual and telehealth services to all of New Jersey and New York. And if you would like to speak with us about anything, take note of our information there in the bottom left-hand corner. We have the autism@medpsychnj.com email, and we have our website for you to learn more. So just a few housekeeping things. I do want to invite you to try the Q&A box, and you can use that at any point throughout the presentation. I will be taking questions at the end, but as you go along, feel free to pop those questions in there, and we'll address as many of them as we can. So just to get started and just to practice using that Q&A box, how many of you have looked into or have been using behavioral health support as related to autism? Feel free to put your answer in there. Not yet. Okay. Yes. Yes. So some of you have, and we will get into more about what behavioral health support looks like and what that is. But I'm curious, for those of you who are answering yes, and that you have, are you generally satisfied with your care, or is there something that could be better about it? Okay. So we will come back to that topic, but I do want to explain to you why we are having this discussion today. And I think statistics are an easy way to explain what we are here to do and what we're looking for. These are some pretty staggering numbers. This is from a published article this year in July of 2023 that has looked at numerous studies and statistics on what are the rates of mental health disorders in autism. What's the correlation and what's the connection? And they actually report these in ranges, which are pretty wide ranges, but I feel it is important to know that the highest number of the highest percentage possible is what I listed here, but I think it makes a point. It is believed, this is a pretty widely accepted statistic, that around 70% of autistic individuals develop or experience a mental health disorder. And, this is something that's very important to screen for, to recognize, and it's why we do what we do every day. As an example, up to 33% of autistic individuals have ADHD. Up to 54% have depression. Up to 54% have anxiety. 33%, up to 33% can have OCD. And bipolar, psychotic disorders, eating disorders are all possible. And I do want to emphasize that these rates are higher than the general population. So we don't know for sure what the exact connection is, but the reason that we are having this discussion today is so that you know and can be aware these all of these things should regularly be screened for, and you should have a very low threshold for seeking care if any of these things should start coming up. I think it's pretty compelling. I think it's helpful to define what we're talking about here, right? So behavioral healthcare is a field of healthcare, and it is it's a very broad field too, as we'll see shortly. But we're looking to focus on the connection between behaviors, emotions, and mental well-being, and I would say also the way that the brain is wired. It encompasses the prevention, assessment, and diagnosis, as well as treatment of conditions. And, this type of care, it often involves a range of therapeutic interventions and multiple different specialties and different professionals. And we'll dig a little bit more into it as we go along. But what we're looking at here when we talk about behavioral health is really improving the overall mental health and giving that person all the tools that they need to promote their well-being. The behavioral health team. There are many types of professionals that can be part of the behavioral health team, and not every individual needs all of these professionals in their life, and not all of them can be helpful in the same way as the others. And we want to, just kind of lay this out here for you to see that there are a lot of different types of help that's available. And we can go through some of these and go through what might be helpful. Psychiatry this is what I do. In the psychiatry field, you have psychiatrists, psychiatric nurse practitioners, and you have psychiatric PAs, which is what I am. I like to think of us as yes, we're prescribing medicine, but also we're coordinating oftentimes the overall care when it comes to mental health and behavioral concerns. We may coordinate with different therapists and primary care providers and make sure that all parts are working the way that they should with the treatment plan. You have different types of psychologists. You have psychologists who do therapy and evaluations. You have psychologists that do a wide range of testing, and depending on what the needs are, you might need a different type of psychologist. There, of course, the core components of any team are the primary care providers. So we want our pediatricians to be involved, and we want our primary care, if they're older, to be involved. And a lot of times the developmental pediatricians are on the team too. Therapy is where the work is done, right? This is could be psychotherapy with your social workers. You may receive counseling. There are family therapists, behavior therapists, speech, and I even included speech and language therapists on here. Now, the reason that I include speech and language therapists and occupational therapists, these skills that children with autism have been developing through these therapies are essential to their mental health. if you think about it, how is their mood going to be if they cannot get their point across and communicate effectively? And likewise, if their body is not well regulated, right? So sometimes, even as a psychiatry provider, I'm coordinating with occupational therapists. So there's a big team that can sometimes be in place, especially with the younger children and maybe more significant needs. Ultimately, the goals of behavioral support are really just that we're looking to help in addressing challenging behaviors, emotions, and psychiatric disorders that may interfere with daily life. And we want to provide strategies to manage and reduce the stress and the negative impact that those symptoms have on their life. I do want to emphasize that behavioral support is not inherently designed to change the person, change the personality, change the core of who they are, but rather to make things a little bit easier for them and give them the support needed to be successful and happy. So let's talk about some primary goals of behavioral health care. Goal number one is really to understand and cope with emotions. Now, that is a very basic statement. However, I do think we should break it down a little bit. Understanding emotions can be a really challenging thing. We may see emotions be expressed on the outside, and we may see that individual has trouble coping with those emotions, but we need to dig a little bit deeper. And sometimes we rely on that person to tell us what they're feeling and why they're feeling it. But as many of us who work in this field, and maybe if you're a parent or you're an autistic person dealing with this, it can actually be really hard sometimes to express what is going on inside and what might be the needs that they have at the time. Because of the difficulty sometimes in understanding and expressing emotions, behaviors can result. And, those actions can have a negative impact. It may not be the intention to behave in such a way that it upsets people or someone is hurt or relationships are affected, but, it does have a negative impact. So part of what we do is to make sure that we're teaching and helping that person gain tools and strategies to identify and manage emotions. Sometimes there's in therapy, there may be explicit teaching of what emotions are, putting names to them, and learning how to communicate those emotions in a way that others can understand what's going on and help. Sometimes, the last statement there, sometimes medications are also helpful. And that is a big part of what I do every day, is to figure out what we are seeing is due to something underlying like depression or anxiety, so that if there's an underlying condition that can be treated with medicine and it can be helpful, that we're identifying that and doing that. But I do think that, and we'll talk a little bit more about medication later, but it's a tool. It's not the only answer. Social skills and communication. Now, therapists can assist in helping that person develop social skills, right? It's an important part of teaching. However, a lot of what needs to go into that is teaching communication strategies too, right? So um, a therapist who specializes in this area would be able to individualize that to the needs of their client and help them navigate social interactions more comfortably. And this would in turn help reduce frustration and might in turn help the behaviors that you see. I think a lot of times we think about social skills and communication difficulties in children because that's when it's most noticeable, right? They have a speech delay, language delay, or they're having trouble interacting with others. It's quite common for this to be detected at a young age and start working on it. But I do want to emphasize that sometimes I will see a teenager who is having trouble communicating, or finding that, especially with COVID and everything that happened, having trouble socializing and working on their social skills. And, this is an area of focus that can be very helpful to the individual. Another area of focus of therapy can be family support and education. I think everyone on the behavioral health team should be able to support the family and educate them about what they're doing and what the needs are. But this is an important component that if you are seeking behavioral health, you should be getting, because things cannot get better if you don't understand what's going on, right? So there can be therapy sessions or meeting with your providers who can really involve the family members, and offer them guidance on how to support their loved one effectively and how to understand their unique needs. Sometimes this looks like informal parent education as time goes on and things come up, and we educate based on the circumstance. But there are more formal parent education systems out there. Another way to support the family, but also this actually benefits the child, is parent management training. And there are a variety of different modalities that are used for teaching this. And it helps the parents to understand how, first of all, understand how to connect with their child and what is going on in this situation, but also how to develop some effective strategies for communication and for behaviors at home. Certainly support groups exist, which can be a really valuable thing for the family or for the individual. I wish there were more of them because I think everyone benefits from a community and from having the support of others who are going through what they're going through. And of course, what we're talking about here too is the support for co-occurring conditions. So not just autism, right? Autism has its own features, but when we have a co-occurring anxiety, OCD, any type of mood disorder, which could be depression, it could be DMDD is like a popular new mood disorder that's out there, disruptive mood dysregulation disorder. It could be bipolar disorder. It could be, any combination of those things. It could be ADHD, which is really frequently seen with autism, right? So we need support for those conditions as well. And sometimes they take over the focus of treatment because of how great the impact is on their life. So this support should look like early identification of symptoms, Now, it doesn't always look like it looks in a neurotypical individual, especially mood disorders and especially anxiety can look very, very different in an autistic person. The to make an accurate diagnosis, that person has to be pretty skilled in identifying what that looks like in autism specifically, so as not to risk a misdiagnosis. Just as an example, for anxiety, let's say, anxiety can manifest as aggression. That can be one symptom of anxiety. And so aggression can look like bipolar disorder. It can look like, sometimes it can look like ADHD. And it's really important to tease out what's going on and identify what it is, because the treatment depends on accurate diagnosis. Other support for these conditions, definitely monitoring in terms of maybe there's a low level of anxiety, but it seems pretty manageable, right? Maybe there is some difficulty focusing in school, but it doesn't require medication right now. Maybe, with the supports, that child is managing well. I still recommend monitoring for these symptoms, even though they don't require medication at the time, because you just never know when it is going to interfere. And lastly, coordination of care. I can't emphasize enough the importance of your care team communicating and coordinating. And we are all so busy, but it's important to, that your care team is willing and able to communicate with each other when it's needed. Okay, so this is an area of specialty that, this is a large part of what I do every day. Medication management. And so I'm sure if you've obtained behavioral health support before, you probably have encountered some discussion about medication or recommendation, or even received prescriptions. So the need for medication is sometimes an important part of the treatment plan. It is not the whole treatment plan, but we do consider it when the various behavioral therapies and therapeutic interventions are maybe not as resulting in enough progress, or there are things getting in the way, of that progress, such as anxiety or ADHD or whatnot. But it is important to remember that there's no medication to treat autism, right? There's no cure that we know of. So the focus of medication is really to treat those symptoms which are getting in the way and affecting the quality of life. Medication management does require a little bit of a different approach, and I will tell you how I do it. I can't speak for anybody else, but when approaching medication management in someone who has autism, I'm looking at the whole picture. I'm considering what is going on medically, medical history, what's going on in school or in work or in that person's life day to day. I'm also considering what types of supports they already have. Are they in therapy? Are they, are the parents supported? Is the family getting along? What kinds of therapeutic interventions are going on? What is still needed? And determine whether can more be done without the use of medication. That might be really helpful. Sometimes I'll see a new patient for an evaluation, and I find out that as a result of a ton of sensory sensitivities, for example, this really high anxiety because they are consistently trying to avoid noisy situations or certain things that really bother their nervous system. And I may say, the first thing you might want to try is to try sensory integration therapy just to get some relief on those sensory sensitivities. Maybe we try some supportive treatment for a little bit, let the OT get going, and then we revisit and then we determine. But sometimes patients come to me and they have exhausted all of that, or they've gotten into a very acute situation where it's kind of a crisis and they don't know what to do. And I'm seeing that it's significant and we might start medication. Sometimes that is apparent to me in the first visit that there's going to be some serious difficulty going through various therapies because of the degree of anxiety or aggression or the degree of refusal or whatnot, so every case has to be taken on a case-by-case basis. But that is how I generally approach it. If there's no other reason to have behavioral health support, I think this is probably the most critical reason to have somebody on the team who is familiar with behavioral health, mental health crises, and what to do in these kinds of situations. Because as we saw before, the high rates of co-occurring diagnoses can result in sometimes a crisis that comes on very suddenly. You may have a rapid onset of depression and that may get severe very quickly, for example. Or there may be a major transition or a major loss or something that takes a, generally stable, functioning person into a situation of complete crisis. Having somebody to go to and turn to for advice in these situations is so critical. And I hope you never have to use it, but if there is a crisis, you want to make sure that you have someone to turn to. There can be immediate support, there can be guidance, maybe there are acute interventions that can be done, or mostly really just to kind of determine, hey, this is a pretty serious thing. You need an intense level of care right now, right? So your behavioral health professionals would be the best equipped to handle and guide you through these situations. That kind of brings us to the transitions. And, this is something that comes up a lot in care with the families and the patients that I see. I think it's a fairly commonly known thing that transitions can be difficult for autistic individuals. So some do really well with transitions, but it's kind of a classic feature that that comes up sometimes with this that transitions can be difficult. So could be moving to a new environment, could be starting a new job, new school, some new phase of life where there's a family change or a new family member or, a family member leaves. Sometimes these transitions can be extremely difficult and result in crisis, as we mentioned. And it sometimes takes a team to help that person get settled and cope properly, but well-trained clinicians can assist in developing healthy coping strategies and to navigate these changes successfully. So this is another important reason that behavioral health support is essential in autism. another reason to have us on board, is advocacy and support services. Nowadays with insurance requirements and all of these things, it's essential to have a trail of paperwork. And if I could leave you with any advice on this, is to keep records for yourself of everything. What evaluations have been done, what kind of supports have been tried, what was the outcome of those supports, what different things have come up, and keep that paper trail, because sometimes to get to a certain level of support, you need to be able to prove what you've you need to be able to prove what you've done, and what you've tried and how successful it has actually been. Clinicians in behavioral health can certainly help you advocate and advise you on how to advocate. There are advocacy services that exist that do specialize in this area, but speaking as a clinician, my range goes to making sure you have all the ducks in the row to prove diagnosis, to support with letters and documentation, and providing recommendations. But sometimes you need something from us, right, to help get what is needed. We can offer guidance on what direction to go in accessing resources, and sometimes this even looks like I have a family coming in who has had no care yet, and their child is struggling, and school is difficult, and they've been through multiple schools, and they haven't had any evaluations yet, and they haven't had any therapy or support. And I'm the first person who they get to talk to, and I'm able to recommend to them, here are some resources that you need to look into, and this is what may benefit your child. So this can be what support services look like, right? Just getting you in the right direction. Or maybe you have a therapist who you're working with who can help guide you also, right? That they know that, hey, you need to go see psychiatry because there might be more going on here than we realized, or because I see a very clear need for medication or something. So we are definitely helpful for that. Now, I just want to summarize what we talked about and then get into some more specifics with your questions and answers. The point that I wanted to get across today is that if you're a parent, let's say you're a parent of a child with autism, and you're seeing your pediatrician and your developmental pediatrician regularly, and you're working with the school, is that enough? It might be, but consider the fact that over the course of time, things may change significantly, right? And we are here, whether it's your psychiatry providers or your therapy providers, we are here to help you to screen for these co-occurring conditions that could be coming up, but also to provide support in all areas to navigate the complexity of the situation, right? It's so much better when we have a relationship that allows us to, like, I know you, right? I know you and I know what you need. And so when something comes up, we're able to help. And likewise, if you're just working with your school and your pediatrician, great, but involve your pediatrician in as much as possible, because you need someone who knows your child really well. I would say the same for adults, right? Is that we, as adults, often we go off into the world and, navigate our relationships and our working situations and whatnot. And sometimes that's really difficult for autistic individuals to suddenly realize, hey, like, there's not as much support out here, and I could really use some support. So it helps to have somebody to meet with regularly, long term. It's much easier to deal with things when they come up that way than to find care in a crisis. And, behavioral health support, again, just to kind of summarize, it encompasses helping emotional regulation, social skills, communication, managing anxiety and stress, addressing the challenging behaviors, right? That there's so much, but the goal is personal growth, it's to grow and to mature and to manage the stress of life in such a way that it's healthy. And through specialized interventions, the result is that the autistic individual understands themselves better, copes better with everyday challenges, builds meaningful connections, right? This is what it's all about. Lead fulfilling lives, all while receiving whatever assistance aligns best with their strengths and needs and helps them get there. And I bring all this up because I want you to realize the benefits of having a support team to go to. It's so much easier to have that and to get ahead of any potential problems than to start putting a team together when there's a sudden crisis. So I thank you so much for listening today. I mean, I hope this was helpful. I hope that you have a clear picture of what support maybe would be helpful that you might need for your family or yourself. There were all those professionals that I listed. I'm also very happy to discuss with you any more specific things and what therapists or professionals might be helpful for you. So you can put your questions in the chat. And I definitely thank you for joining today. And also, if you're not comfortable putting it in the chat, I mean, you can use the anonymous name, but if you have a question that you wish to be anonymous and not in the chat box, you can send it to that email that I listed earlier. And I will take questions now. I saw the question about enabling closed captions. I tried to figure out how to do that, but this will go onto YouTube after the recording is up, and you will be able to have that on the recording. So I apologize for that, but oh, this is a great question. Is occupational therapy helpful for older adults? So occupational therapy is actually has a couple of different modalities, and traditionally, probably historically, the perception of occupational therapy for older adults is helping motor skills, and maybe they lost some function because of some medical illness or stroke or something like that, right? And so occupational therapy can help them get back on track with their motor skills. What you might be asking, I would assume, is yes, while we know it's helpful for functional skills, definitely, there may be a sensory component to it as well, right? So some of what I refer to occupational therapy for is actually the sensory integration therapy. And that is, not all OTs do that. That is a specialized area that they go into. And the sensory integration therapy can be really, really helpful for navigating certain situations. I have some older teens and young adults that I've referred to OT because maybe they go into a room and they can't tolerate light being on, or they trying to go, they're in college or trying to go to classes and they're having difficulty dealing with the environment around them, or there are certain things that affect them with their balance or their sensory system, right? They have sensitivities or they have a need to seek sensory input. And I have absolutely referred adults of that age range for the sensory integration therapy. I think the older you are, the more the brain is, obviously the brain finishes its development at a certain point in time. Maybe it's 25, maybe it's 27. It's somewhere in that range, we think. But older adults, I would have to ask one, I don't know how old you mean, but the older adults, I think it doesn't hurt to ask, because in my discussions with occupational therapists that does the sensory integration work, they can certainly help. So it depends what the needs are. And this is if there is a specific, well, I'm having this problem, but I don't know, could occupational therapy help me with this? You could certainly ask your primary care clinician or your pediatrician, or if you're in psychiatric care, you could ask them. I would look into it if you think it might, if you're at a place you think it might be helpful. I want to try something. Why not? Like dyspraxia with the balance. Yes, a lot of what they work on, the vestibular system, the balance. Absolutely. That is very, core to what they do, is to get that nervous system. I describe it, and maybe there's a better way to describe it, but getting the brain to connect well with the internal systems of the body, and likewise getting that all the sensations that we receive, all the signals that need to go to the brain for the brain to interpret it. Sensory integration therapy can keep that super highway of communication at, in top shape. So, yeah. What other questions? Does anybody have a question about about maybe what psychiatric care should look like, or what psychiatrists do? Or maybe what types of therapists might be helpful for a specific thing? I, of course, may be a little bit, oh, here's a good question. What is the best therapy to prevent meltdown? Great question. A lot of what I do with my patients is to try to figure out what caused the meltdown. I find a lot of times it comes into a realization that there is an undercurrent of anxiety. The way that I approach it is, as a parent, I would look at, or even as if this was me, the way that I would look at it is, first, let's look at the basic needs. Are we well fed? Are we tired? Did we get enough sleep last night? Is there something on the horizon that's new or different? Right? What is preceding that meltdown? So many times the answer is tired or hungry. And so, in my experience as a parent, I'm looking at, okay, let's try to feed them. Let's see if that's going to work. But, sometimes they get to where the meltdowns are really severe, right? And so sometimes that's a different thing. There are tantrums, and then there are real meltdowns that can last for an extended period of time and maybe have some sort of destruction or aggression, or just really major self-deprecation or something. So it depends a little bit what type of meltdown, but you always have to look at what was going on ahead of time. Sometimes there's no reason. And that's when I come in with, trying to figure this out, and does this person need medication, because a lot of times we can't find the trigger, or there are just so many triggers. If you determine, well, there's always a meltdown around getting a shower, or trying to give them a bath, or something like that. It could very well be a sensory thing. Maybe there's a routine, trying to go through a routine, and the routine has to be the same way, and we can't stop the routine in order to get out the door on time, and thus a meltdown occurs. Well, that might indicate that that person is having trouble deviating from their routine, and maybe there's an OCD component to it, but maybe not. It might just be a high degree of need um, for that routine to happen, and then therefore, then you can problem solve, right? So a lot of this is figuring out what the triggers are, what happened before. When you start to understand the triggers, then you can start problem solving. But a lot of times, this is when you need your behavioral support team, whoever that is, to help you kind of figure out different strategies. We can think of so many strategies on our own, but sometimes it's hard. So if a child or young adult gets triggered whenever something gets difficult and shuts down, and sometimes shutting down is the same issue as a meltdown. Um, it Depending on how familiar you are with this, I use this a lot, but the fight or flight mechanism, right? When something is triggered internally and that anxiety response kicks up, we want to fight it, which you know can look a lot of different ways, but or we want to flee from it. And so sometimes shutting down is like a way to avoid that perceived stress or danger. Um, the question is about what kind of therapy helps them regulate themselves in those situations. Now, if your goal is to regulate internally, this is a lot of where your psychotherapy comes into play. Identifying the feelings and the emotions, putting names to it. There's a lot of, and this depends on how old the person is and what their abilities are, but learning about the situation and what the emotions are, and learning about the triggers. Psychotherapy would be fantastic, and also in terms of giving skills of what to do in the moment. If it's a young child, you can't reason with them. If they're unable to take the skills that they learn from psychotherapy and apply them in the moment of this stressful situation, right? So then sometimes this requires those around them to help them regulate. And co-regulation is a really important skill for those who are in a child's life to learn, because what we say and what we do has sometimes a really significant impact. So there are many parts to analyze when you look at that meltdown, or the shutdown, or the avoidance, or even eloping, right? So usually you have to tackle it from the very beginning. You have to start from picking that thing completely apart and understanding what triggered it, what is happening, why is it happening, what works, what doesn't work, and then putting together a plan. So, like I said, that can be psychotherapy. In the young children, that can be more the behavioral therapy, like the ABA therapy, that is focused on, understanding the situation and giving them strategies. So I hope that helps, but it does depend on the situation. And that sometimes they come to me and it looks to me like anxiety, right? They shut down because they are too anxious to deal with that situation. And depending on the severity, yeah, it's certainly at times a reason for medication. Sometimes. Question about biofeedback to regulate anxiety or fight or flight response. Biofeedback as a whole, I think, is a really underused technology. I do think that you want to use that when you have other supports on board as well and integrate that into the overall treatment plan if you're going to use it. We do, but biofeedback is getting that brain connected to the body, and we want to do that, right? That is the goal, to be able to give the brain control so that that person can think, what do I need to do in this situation and how do I manage it? But yes, there are some good, there's a good evidence base out there for doing biofeedback for anxiety. I will, as anxiety as a whole, especially, I would say the fight when they get into that like fight or flight place and they are really heightened, and then you're seeing the meltdown and you're seeing the shutdown, I would question if that person is able to access those skills in the moment, or able to access the biofeedback device or whatnot. You have to kind of look at that situation. As a whole, can it help regulate? Yes, I think of it as one tool in the toolbox that might be helpful. But I would also caution that if it's agitating and it's causing more stress to do the biofeedback, maybe it's not the thing to do, and sometimes there's a trial and error of options. What is biofeedback like, and is it covered by insurance? There are actually different kinds of biofeedback. The technology now is very advanced, and there are so many different kinds of biofeedback, and it depends on what the indication is for. Could be something as simple as getting that person to pay attention to their heart rate and incorporating that with a therapy to kind of bring awareness and bring that person control over their heart rate and their physical body response. And sometimes it's more complicated with computers and whatnot. There are a good number of programs that are out there. I'm not aware of any that are covered by insurance. My guess is that if there is something out there covered by insurance, it's probably for a very specific diagnosis. So I don't know. Off the top of my head, I don't know of any that are covered by insurance. Okay. Any questions about medications or anything? I mean, I wouldn't go into specifics about a specific person, but just in general. Or questions about any other types of therapies or. Okay. Well, this was really great today. I'm so thankful for all of you. Oh, I see a hand raised. Megan, I can allow you to talk if that's what you would like. Oh, I see your question. Okay, is there anything beyond mood stabilizers that can help, such as antipsychotics? Oh, absolutely. I think that because certain medications have an indication for autism specifically, like, a great example, let's say risperidone or Risperdal, that has an indication for irritability and aggression in autism. So it's commonly used and recommended, and it comes up a lot because it's, FDA approved. But let's not forget about other classes of medications that might be really helpful. Antipsychotics have a mood stabilizing component to them. So, we do use them if we feel the mood is, uh, you know, all over the place, or they have significant emotional dysregulation. But a lot of times you can get benefit to the mood from your traditional antidepressants. So sometimes you can get help with the mood because of treating ADHD. You actually treat ADHD and it stabilizes their mood. I see that sometimes. So it depends on what the other diagnoses are. But yes, there are so many other medicines. And I think this is where you really want to have a psychiatry provider on board, because if you're being told, well, your child's aggressive, they need to go on risperidone, you might want to look at other options. That's actually not preferred if it's not an acute crisis, and actually preferred to try other medications first that don't have that actually don't have the FDA approval for autism, but have approval for other diagnoses. So yes, there are so many things that can help. Yeah, antipsychotics can be very helpful tools. We use them all the time. That's part of what psychiatry is. So I would recommend, if you're interested in that, hopefully you have a psychiatrist. Okay. Well, our time is almost up here. So I do want to thank you for coming today and asking questions and engaging. And I love to see the questions. That's why I leave so much time for questions, because I want to know what you're interested in. And if you have any topics that you would love to see covered related to autism, that's my focus, and I would be happy to put together something if you feel that there's an area of education that's lacking in this topic. And likewise, we have other therapists from our office who are doing webinars and things. So feel free to use that email and email any ideas that you have or things that you would like to see. And if you need any services, again, visit our website and we'll see if we can reach out to us. We'll see if we can help you. Thank you so much for your time and attention today. Bye.